Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and our industry's trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Dr. Warren Jesek. Now, Dr. Jesek has achieved a master's in the Academy of General Dentistry, and he is the 2018-19 president of the American Equilibration Society, we know as AES. His core message revolves around comprehensive care for the entire family and a systematic method to deliver excellence with consistency. So in our this episode, we're going to discuss overall about your courses. I know you have 4 courses on our bureau that cover a wide range of subjects. And so, Warren, I would ask you to start by sharing with us what are the topics that you cover, and then tell us what you feel would be important for us to know about your courses.
Well, one of the courses I've lectured on several times or topics is comprehensive dentistry and dental team. And this is a fit for the entire staff. I mean, it's fun, it's fast moving. It has tips on how to communicate with your patients better, communicate with your staff, keep your staff happy and keep them working for you. And it's really geared to the staff and the whole team. It's one of the most fun courses because I'll bring them in and we'll do some things and we'll change it and kind of go on with the run. But it's good it's a pure lecture format. It can be 4 to 6 or 7 hours. And a lot of information, especially from the years of my experience of practicing and so forth, will be shared with the staff, the team, and young doctors, and even us old guys can get something from this one. It's a lot of fun. And then the other course that's in there is Achieving Excellence in Restorative Dentistry, and it's kind of a potpourri of everything that I've learned from the masters in dentists, what I learned when I was restored years ago, and how to be successful over a period in time. And there's tips and techniques for your staff to work better with doing that, helping you work with your patients, how to incorporate the modern dentistry, the CAD/CAM dentistry in with the old. You don't want to throw it out, the old wisdom and knowledge that's been there from the scholars from past and the masters. And so I've had a journey where I went from articulators and face bows and models and study models and casts and everything else to CAD/CAM dentistry, iTero, Invisalign, all the fun stuff, 3D printing, implants, implant guide. So that's kind of in there. And then we can kind of talk about, I've got the creative treatment planning course, which really kind of is what works and what didn't work, and where did I come up with it, and what did I do for diagnosis and this or that. And you can see that, oh, wow, he did this case 25 years ago and it's still working. And so why was that successful? And I also freely discuss what failed for me. I throw rocks at myself. I throw rocks at my own house, not at other people's houses. I throw them in my house. So that particular course is really kind of good for the dentists and the staff, even because they get to see life through another dentist's eyes, because what I did was I was mentored by Pete Dawson and Guy Haddix and even Spears, listening to his speak, and all these guys. They're really into serious dentistry. So I fall into those camps, especially LD Pankey and the Dawson Institute. And that knowledge I want to share with people. And so that course really gives people how I've looked at life. And then my true baby project, the one I really love, is to talk about TMD and occlusal muscle issues. And my real true goal in that course is to help people diagnose TMD and know the difference between occlusal muscle issues and whether it's a vascular migraine. But the goal is to take the young and old clinician and sift through the literature that's there and find out what's there and have the take home, the nice package that you can go home and the first day back, you'll do something to a patient that they'll always remember you by, and you'll get them out of pain. You'll save them a lot of misdiagnosis and trouble. So, and that course is also can be hands-on for 2 people or 30 people. It's also a pure lecture format, and all of my courses can be 2 hours all day. I'll start on time, I'll finish on time, and I'll cram a lot into it, even if I have to do just a 90-minute one. So I think all 4 of these courses kind of collide in the same place, but they have a different approach and a different emphasis, and I think they're all really nice. I've got good feedback on them over the years.
It does sound like a really nice mix. And so I would throw into this my observation I've known you for several years now, and we work together. And I would say that if I were to be telling a meeting planner about Dr. Warren Jesek when you weren't in the room, and I wanted to offer what what I felt would be really helpful to get to know, I think you've had 30 some years practicing now, right? Remind me.
We're pushing on 39 now.
So we're getting close to 4 decades, and I think that is a lot of experience.
I love it. I love it. I've never been accused of not being passionate.
That's another thing I would say. and I think that's really wonderful as far as the energy level for keeping people engaged in your courses. But I think around the nearly 4 decades of experience as a clinician and the many years of continued education, learning from various masters in dentistry, I think that speaks to a course material that can bring a wide range of views on certain topics, and to be able to present from someone who definitely has walked the talk, and has a lot of experiences. So I'm so excited that we're able to work together through the Bureau and to be able to offer these courses that are really valuable. Now, before we wrap this up, Warren, is there anything that would be important for the meeting planner to know? And I would love for you to chat a little bit about, I know your courses qualify with an AGD for credit. I think that's an important point, but is there anything else from the meeting planner's perspective that would be helpful for them to know?
I'll work with them. I'm easy to work with. I really am. And you can count on me to be there when I said, and count on me to deliver. And I'll give a good product, because I'll make sure. But I really, 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 really like helping people.
Yeah, I love that. You definitely have a servant's heart that way. And thank you so much for being here and sharing about your courses with us today. And for the event planner who would like to find out more about bringing Dr. Jesek in for a course or two, you can find his courses listed on dentalspeakersbureau.com. You'll find his contact information there. If you'd like to reach out via email, info@dentalspeakersbureau.com, I can help connect you. Thanks again for your time. Thanks for being here, Warren. It's been a pleasure. And until next time, be well.